In this video tutorial, I will discuss about the ischemia of the heart disease. Actually, I will discuss the ischemia in pathology when I will inshallah record my pathological lectures in detail. We will discuss about the ischemia. But today I will very briefly discussing the ischemia that it will assist the metric students, even though in the chapter 9 there is myocardial infarction and angina pectoris also present, and then also assist to the FSC students. And the very basic level that everyone can know about the ischemia. What is ischemia? What is related to the ischemia? First of all, the myocardium of the heart. There is a second layer of the heart, like the three layers we have. One is the innermost layer is the endocardium, then there is a myocardium, and then there is a pericardium. The myocardium of the heart must have very good supply and efficient supply of the oxygen to proper functioning or for performing the better functioning. So even though every tissue needs the oxygen well, in heart, actually in myocardium, if there is no oxygen supply matches or imbalance between the oxygen demand and oxygen supply, if there is an imbalance between the oxygen demand and oxygen supply, then we say that myocardium experiences the ischemia. And even though not only myocardium, if there is some tissues, if there is the oxygen supply high or oxygen supply down and the oxygen demand is high, so we can say this tissue is facing or experiencing the ischemia. So the very basic definition or very basic concept regarding the ischemia, that simply there is an imbalance between the oxygen demand and oxygen supply. There is a demand supply imbalance between the oxygen or between the tissue and the oxygen levels. This is simply ischemia. Actually, there are the many underlying mechanism to deficient of the oxygen supply. Like if there is a to the heart, actually the major vessels that provide the blood towards the heart is the coronary arteries or coronary vessels. So if there is a plaque formation, like there is atherosclerosis, if there is a fatty acid plaques formation, or with the age there is a thrombus formed, so the atherosclerosis may be the reason for the narrowing of the artery. So there is a less blood supply and there is oxygen deficient. Another, if there is a you can say the platelet plaques formation and the big thrombus formed, so there is a narrowing of that. So there is a you can say that the underlying mechanism, whatever the underlying mechanism, the main thing that is the narrowing of the arteries, and there is a shortage of the blood supply and the difficult of the blood supply, blood movement, and ultimately there is a less oxygen supply and the demand is high, the oxygen supply is low or the less. So we can say the particular tissue or the heart faces the or experiences the ischemia. The clinical manifestation of the ischemia, this is depend upon the clinical situation. Actually, remember one thing: ischemic heart disease is not one disease. This is a group of disorders. This is a group of, you can say, the clinical pathological conditions or the syndromes. There is no one single disease. So there is a different clinical manifestation in which we will discuss today. One is the angina pectoris and one is the myocardial infarction, because these two major are very confusing terminologies, and most of the students and most of the people should know what is the angina pectoris and what is the myocardial infarction. First of all, angina pectoris. If there is a short ischemia, acute ischemia we can say, and there is a time duration is very little, short time, and the blood supply is good or oxygen supply is normal, and it is reversible. If this is reversible and there is no myocardial cell death, you can say there is no myocardial necrosis. So this is the, and come as the chest pain. This is the angina pectoris. Now again, what is angina pectoris? There is no myocardial necrosis. Myocardial cells will never die, and there is reversible or acute short duration of the ischemia. Ischemic experiences is short duration, short time, and it is reversible, and the myocardial cells will never die and come as the chest pain. And usually there is a classical angina pectoris chest pain is central chest pain. So we can say this is classified as the angina pectoris. Usually it is precipitated by exertion, or you can say that taking the heavy meals and walking along against the wind cold. Why there is a wind cold? Actually, wind cold constrict the many blood vessels, and if the constrict the many blood vessels, heart will pump the blood very hardly, and the workload on the heart will high. So it might be possible it will face the ischemia. So these are the different clinical manifestation of the angina pectoris. Again, this is a central chest pain. The pain will be the dull, diffused. Diffused mean if it is not like someone cannot tell the where is the exactly pain. The pain origination or radiation is where. Like if someone comes to you and tell that I have a pain right now, right there, so it is not the angina pectoris. Maybe it is probably it will be the anxiety pain, because anginal pain you cannot tell. This is diffused. You cannot tell. You can tell that like this area is pain, but you cannot pinpoint the pain. So anginal pain or angina pectoris, in angina pectoris there is a pain, central chest pain, which is dull, diffusible, and precipitated by exertion and upset, emotional upset, and then there is the heavy meal and walk against the wind, cold wind, and it may be radiate to the one arm or maybe the both arm or the neck and the jaw, and usually undo with the simply taking the nitrates or taking the rest. So this is angina pectoris. Now come to the myocardial infarction. Myocardial infarction as compared to the angina pectoris is not milder or is not acute. It is the severe pain and it is prolonged pain, and simply cannot you can say the undo with simply taking the nitrates or simply taking the rest. And more probably, and the most important thing regarding to the myocardial infarction, that in myocardial infarction there is the cell death, there is a myocardial necrosis, but in angina pectoris there is no myocardial necrosis. And one more thing, actually in during myocardial infarction there is there is the myocardial pain very strongly associated with the autonomic upset. Autonomic nervous system, it also linked with the hypothalamus and emotional upset. So there is a tachycardia and tremors, and even though sweating in the cold weather, because if someone comes to you and this is a winters and he has the sweating, so it is might be probably there is a severe conditions or severe myocardial infarction. So this actually ischemic heart disease also has the many different things like sudden cardiac death, and there is a chronic heart diseases. But today I just mentioning the very briefly the angina pectoris and the myocardial infarction. So underlying mechanism, whatever the underlying mechanism is, the angina pectoris mainly is the central chest pain with the dull and diffused pain, usually precipitated by the exertion and heavy meals and emotional upset. And one thing that you must remember, that in angina pectoris there is no myocardial necrosis, but in the myocardial infarction there is myocardial necrosis, and it is myocardial pain is the prolonged and the angina pectoral pain is the less acute, the short duration. Thank you.